1,001 classes in med school and none prepares you for how it feels the first time you lose a patient.
So, like we just said, despite having thousands of lectures in medical school, none prepares you for how to react when you lose your first patient. So everybody gets to have that experience. So for me, I remember the day I lost my first patient. It was a 6-year-old girl. I cried my eyes out. Oh my god. The matron had to take me out of the ward. She was like, Dr. Pafo, you can't be crying here. She was like, no, you can't be crying here. But I was so emotional. Fine, I gathered, I summoned the strength that was left in me to just bold face, talk to the parents about it, and then I left. And it was so painful. I remember that day I cried so much. My mood was so down. These days, even when you lose a patient, there's still that empathy you get, that I'm sorry for your loss and all of that. But it just ends there. You are not crying anymore. You are not. So I think for Peju, every doctor actually goes through that phase. I don't know.
Step 1, wake up, brother, gonna rise with the sun.
I hope you guys have been amazing. Anyways, I've been fine. So I want to say thank you to all of you guys that have been following. You guys are the real MVPs. And if today's your first time here, I want to say you're welcome to join us. And I'm sure you're going to be glad that you stopped by here. All right. Okay. So if you're yet to click on that subscribe icon, I think this is just going to be the best time for you to do so. So just click on that subscribe icon down below this video and become a part of us. Tap on the notification bell so that anytime I put up a new video, YouTube will notify you. Okay. So I don't know if you guys have seen my video where I reviewed the first episode of our first ever medical series. Are you guys feeling my rhyme? Okay, you may not feel it, but whatever, I'm trying. Okay, so I got a lot of comments and everything, and I really appreciate. But today I'm going to be reviewing the episode 3. Yeah, but guys, what is a review without criticism now? You get like, okay, but I'm going to criticize it, but I'm going to do it in a very soft and nice way. You get a guy was brought in with vomiting blood. That is what we call hematemesis in medicine. So over to when Dr. Chooks invited the interns to his office and was asking them questions about the differentials. Now,
who wants to start? The patient is stable now, but we need to find out why he was bleeding.
Sir, I think we can rule out dysentery, enteritis, any gut infection.
Or is Dr. Coca here the only one who went to medical school? Dr. Mogado?
I don't know, boss.
Cirrhosis, scarring of the liver.
What else?
Peptic ulcer?
Well, ulcer.
Go on.
Cancer.
You know what cancer is.
What kind of cancer?
Esophageal cancer. Throat.
Pancreas.
It's in your abdomen. It secretes insulin, helps your body use sugar.
Yes?
Stomach?
You know what that is.
It could be any one of these things. But since we can't test for all of them at the same time, which one do we rule out first?
Ulcer.
And how do we do that?
Take blood and stool and test for H. pylori.
Differential is that, okay, what are the conditions that can give this particular symptom? Now, in that case of this guy vomiting blood, there are so many things that could actually cause that kind of symptom. So now what a doctor does actually basically is that you have a symptom, you think of like 20 things that could actually cause these symptoms, and then one by one you start asking questions that will rule out each of these differentials until you have narrowed it down to the least you can, and then at that point you go for your investigation so that you can confirm which one exactly you are dealing with. But we saw in that scene that was not exactly what happened. Number one, they didn't have enough diagnosis. Now, but however, they tried. At least with the few diagnoses they have, they were on point. But what I wasn't comfortable with was the fact that, of course, Peju was the first person who spoke. I wasn't comfortable with the first thing she said, which was dysentery GI infection should not even feature at all as a differential. If the case was maybe passing bloody stool to Kizia and then she had said dysentery, okay, maybe. But why would you say dysentery when the person is vomiting blood? That is upper GI bleeding. Dysentery is totally wrong. It's totally out of it. Now, when you talk about GI infection should like come down. When you have said everything, I don't have anything to say again, you just want to talk again. That's when you mention GI infection, because not many times do GI infections cause hematemesis. There are so many other things that could cause hematemesis. Very common things should be said more. You get like, in medicine, they always say common things occur commonly. So talk about the common things that you see every day or that are more likely to happen. Like a complicated peptic ulcer disease, somebody who has binged on alcohol and has a malarial tear. You want to think of liver cirrhosis, you know, just like they said too, you want to think of a bleeding disorder. Is this person on maybe a medication like anticoagulants that could thin out the blood and cause them to bleed? You know, was there any history of trauma? You know, you want to ask a lot of questions. What if this person was involved in an accident? You get, before you even go to the history of cancer, for, you know, you want to ask about the esophageal cancer they tried in the initial things they said. But I feel like what Peju said was just totally out of the way. They should delete it, you know, from that scene, you get. So now the another thing that I feel they didn't do well was the fact that they didn't actually reach a diagnosis. You know, number one, they didn't reach a diagnosis. They didn't you know, after they mentioned like 4 differentials, the next thing is the guy was like, okay, so how will you make your diagnosis? So it's more like you're going to investigation. So you don't rule out first with investigation. No, that's not the first thing. You want to rule out with your symptoms first. There are some symptoms that if you are thinking that this is a liver cirrhosis, there are some questions you should ask. And to rule out that, okay, this is not a liver disease. If you are thinking peptic ulcer disease, there are questions you should ask to rule out peptic ulcer disease. If you are thinking that maybe this person has abused non-steroidal anti-inflammatory drugs, there are questions you should there are questions you should ask that should give it away, that should make you know that, okay, I am not dealing with cirrhosis. Oh, I am not dealing with trauma. There are questions you should ask. So when you have asked all of those questions and you have ruled out some, and then there are now some that maybe you are not able to get the exact information, or maybe they seem like the patient like you are not very clear about whether this patient has it or not. Those are the ones you should now consider for investigation. Because if a condition has like 20 differentials, are you going to do investigation to rule out all those 20? That is not going to be economical in a place like Nigeria. So they should have actually ruled out with their history and examination before getting to the point of investigations. Now, they were correct about the investigations. They mentioned H. pylori, endoscopy. Fine, that's good. But the thing is, I don't understand why that patient was rushed to the theater without those investigations being done. So I will say that that patient was poorly and was badly managed, you get, because number one, you had not reached the diagnosis. Number two, you have not even properly investigated. Why will a patient with hematemesis be wheeled to theater when an endoscopy has not been done? There are so many things that should have come before. What specialty is Dr. Chuk saying? Is it like a jack of all trades? You know, the only category of doctors that could fit in that kind of specialty would be the family physicians. But even in that kind of case, I feel you should have either consulted a gastroenterologist or referred that patient. After the patient has been stable, you should have referred to a gastroenterologist for proper management. Because I don't understand what surgery was done. Why was that surgery done? What was meant to be achieved with that surgery? Endoscopy has not been done for a patient with hematemesis and you are taking the patient in for surgery, because endoscopy is one of the major investigations that you should have done, because it can either be therapeutic or even be diagnostic. You get, it helps you to be able to visualize where exactly is this bleeding happening, you know, what exactly is going on at that point. If even in cases where if it's necessary to take a sample that you can take for biopsy, I mean, you can also achieve that with an endoscopy. But none of that was done and the patient was rushed into theater. So I was not surprised that the patient died anyway, because that patient was poorly managed. I think they are just like they do in every class, that, you know, people that they don't have interest in this whole medicine thing. But
Dr. Mogado.
I don't know, boss.
Nedu is not afraid of anyone or any occasion. He's one of those people whose parents forced him to study medicine. His parents are doctors. His grandparents on both sides are doctors. His 3 siblings as well.
You know, they just have this ancestry of medicine, and their parents just feel like they just have to continue that medicine in their family line. And so they force this innocent child into medicine to come and suffer. So you tend to see such people, they don't have so much interest in it. So I'm not surprised that they do is like that. Now, doctors like Olaniyi, I don't understand. Why will you not say anything? Is it that it doesn't have any clue at all? You go like you don't have anything to contribute at all. That is totally wrong now. Like in real life setting, that guy will not remain in that consulting room. They will walk him out, because how did you go through med school and then you can't talk about hematemesis? I'm not even telling you that come and talk about one crazy neuro dad in your life. They are telling you to talk about hematemesis that you see, like it's something that is very common. So now talking about the theater session. Wait.
Call the OR. We have to operate. Dr. Koga, you're assisting. Yes. Get it all out. You're in good hands. Deeper. Got to play 150. Now. Clear. 200. Clear. Bump it.
Yeah, I really don't know. I've talked about the surgery before. I don't understand why it's only the interns we are seeing. We are not seeing the rest. It's just the interns that assist with surgery. That is wrong. In a teaching hospital setting, the cadres are very, very, very important. You get, the consultant should not be with only the intern. The year of internship is more like a practical year for you to learn. So most times what you do is you watch, you observe. You get, an intern should not be like the major. Some correction should be made about that. They are very, very important for it to actually look real. Like the way Bailey was to Meredith and the other guys in Grey's Anatomy. You get, and then before the attendings like Shepard, like Buck, I was so surprised that they actually fell for that whole defibrillation thing. I mean, now like when you're watching American series, before Jack, the next thing they have brought out their paddles, the next thing clear the shock. But you guys also fell for the same thing. Not all art readings are shockable. You get, there are 2 shockable readings, there are 2 non-shockable readings. So for the non-shockable readings, even if you shock, nothing's going to happen. Non-shockable readings like the PEA, the pulse electrical activity, and the asystole, your paddle is not going to do anything. And from what I could see on that guy's ECG, it seemed like that guy was in asystole. So that paddle was not going to do anything to the patient. So what he was supposed to do was actually continue the CPR. That is why I was saying that it's actually very important to have like a doctor involved in this, just to give a better picture of how to do things. And I don't mean a junior doctor, I mean like a senior doctor who understands what happens in the emergency. So going over to Mrs. Aregbesola.
Yeah, my husband don't try make we get picking. They work. Now I say make I carry myself come now make you see me.
How long have you been trying?
6 months now.
Okay. Do you have any children?
Yes, okay. I guess 7 girls though. Nah, boy, now me and my husband they fine.
So what's the matter? How can we help you here today?
They say I get HIV.
Okay.
You don't reach 3 months.
Okay. Does Mr. Aregbesola know?
He have it from out.
Have you been having unprotected sex with your husband?
Hey! Unprotected? God forbid. What do you want to do with that one now?
Does he wear a condom?
Condom, okay. Say Aregbesola see condom.
Does he, your husband, know that you have HIV?
What take concern Aregbesola concern that one? I don't tell him, say, I get crow. I can't tell her, say, make it wash himself very well, though. The crow and the HIV, not be the same thing.
Now, patients like Mr. Aregbesola, I don't just want us to see like it's a movie, but actually it's the reality of a lot of people. You get, so you see some persons that they are positive, like HIV positive, but they don't tell their spouse. Nobody knows. And they think that the reason why they have to do that is so that they are not stigmatized. But they also decide that you telling this person on time means that this person is also going to get tested, and this person is going to start treatment on time in case this person already contracted the infection. But you're not telling them puts their life at risk. They will not even know that anything is going on, except they just find out incidentally. So I feel like, okay, I don't know what you guys think about it, and I would like you guys to drop your opinion in the comment section. But I think that is not fair. Like, fine, there are so many things that could go wrong. Your marriage could end, a lot of things could happen, there could be a lot of consequences. But I feel the most important thing should be you preserving the life of your partner, and that to do that you have to let them know about what is going on with you. So there are so many people like Mr. Aregbesola who are not open to their partner about their health condition. And in medicine, there's something we call patient confidentiality. It means that whatever happens, whatever I discuss or my patient discusses with me, I do not have the right to tell any other person except with a permission. So even if it was the daughter of that woman that brought her to the hospital, except she gives me the permission to talk to her daughter about her health condition, I do not have the right to. And if I do it in places like, outside the country, it could actually cost you your license. It could cost you your medical career. Because that patient can sue you. Patient can be like, I don't want my daughter to know about my condition. Why did you go ahead and tell them? So it is something very serious and something very big. Even though in this part of the world, we just carelessly talk to patients' relatives about their condition. No, anybody. In short, you don't even tell your colleague who is not involved in the management of that patient. And Dr. Kpeju did so well by agreeing that she's not going to tell Mr. Aregbesola. So that's why sometimes you should not be emotional. Because if a person is emotional in this kind of situation, you can be like, no, I'm going to tell the husband, why is this, why is that? You do that, it can cost you your own medical career. So the best that can be done in this kind of situation is to actually encourage the person to encourage the person to actually speak up and talk to the partner about it. So until you're able to encourage that person and get that person to the point of seeing reasons to tell the partner, you don't have the right to tell the other person's to tell the partner about it, even if the partner is your patient. However, in some countries they have what we call a partner protection program, which is more like you don't, in conditions that they feel you will constitute harm to the other person. Okay, so one occasion in which you can breach a patient's confidentiality is when you know that there's a risk to another, there is danger that can be caused or harm to another life. Now, maybe let's say in a case of mental health, where this person comes to your consulting room and this person is already saying that, oh, I'm going to kill so person, I'm going to kill so person. In that kind of situation, you must breach the confidentiality. You must let the people know that, oh, so person's life is at risk, so that that person can, you know, seek for cover, you know, and just stay clear of that person. But in a case like this too, they consider it dangerous, that this person can actually harm the other person. And so if the patient is encouraged to tell the patient and the patient doesn't want to, there is a program that will, through which the hospital will inform, you know, the spouse. In such situation, it's more like you are forced to actually tell your spouse. And I don't even understand, what is this whole freak about looking for a male child? This woman already has 7 daughters and then she's still looking for a male child. Like, for what? Now, there was something that Kweju did that I really liked. The fact that she screened Mrs. Aregbesola well, I really liked it.
Okay, please feel comfortable. I'm going to ask you to raise your legs. Don't worry, you'll be covered. Okay.
You know, that is something that many times you don't get to be able to do in some facility. That was perfect, because anytime you're examining a patient, you're supposed to think about that patient's privacy. You want to cover them, you want to ensure that they are not exposed, because you know, now there's this safety that comes with examination. However, there was something I feel she didn't do right. Such intimate examination should not be done without a chaperone. You know, the previous teaching used to be, oh, if you're of the same gender, you can do it without a chaperone. But now, with the whole, you know, there's a lot of things changing around gender now, you know, the whole LGBTQ thing and everything. So you cannot just assume that, oh, because we are the same gender, like we are the same sex outwardly, like we may not have the same sexual orientation, you get. So that is why it is better you do it with a chaperone, so that no matter what happens, you know, there's a third party that can witness whatever happened between the two of you. Because there have been cases, the doctor sees the patient, manages the patient, and then the next thing, the patient comes and says, oh, that this doctor abused, and maybe like maybe while trying to do vaginal examination, doctor was fingering. I know now CCTV will not reach that consulting room, so it is just a word against yours. So the only thing that can save you in such a situation is that there's a chaperone, and the chaperone will also document, and you also write in your documentation that, okay, well, this was the person that chaperoned that all. So I feel that is something that we should actually, you know, bring into our practice here in Nigeria, even though it's very difficult because we don't have a lot of people working in the hospital. Like Jasmine, you know, you just always need such people in your life, you get. So they are very, very important. Those way that we pat your head at every point in time, you know, when you are down, and we just make you feel like, you know, somebody loves you, somebody is there with you, somebody is just here to bear your pain, and you know, everyone actually needs such friends. Okay, so this is how I'm going to be ending this video today, and I'm sure you actually had a great time. All right, so till I see you guys again, make sure you stay safe and you stay healthy. Don't forget to like, to comment, to share, and also to subscribe to this channel. Bye.